Now, with an important medical concern across the nation, the number of maternity care deserts are increasing. Now, with hospitals and delivery units across the U.S. closing their doors, leaving expectant mothers searching far and wide, often traveling long distances to seek any kind of maternal care.
Yeah, that's right. ABC's Faith Abubey spoke to mothers struggling in some of the most impacted areas, including the Yakima Nation grounds in Washington state, with few options to turn to as they near delivery.
We're getting back into our normal lives.
Early on in her pregnancy, Tori Wapsheli made plans to deliver her second child in the same hospital as her first, Astria Toppenish Hospital on the Yakima Indian Reservation in Washington state. But with just 3 months left to go, the hospital suddenly shut down its labor and delivery ward, leaving her scrambling.
I think it was just nerve-wracking.
Sierra Wheeler was more than 7.5 months along. The hospital closure would mean a 45-minute drive to the nearest delivery unit.
It was something that I was stressing about.
The Yakima Indian Reservation spans more than 1 million acres, and pregnant women looking for care are often forced to travel roads that can easily become dangerous depending on the weather.
The traveling distance plus the resources that are needed to get quality care are not there.
Jessica Whitehawk founded the Tatawach Birth Justice Center with the help of birth advocates Leslie Swan and Simone Dittenholler.
It's a fresh light. We're providing a safe space, whether it's for 5 minutes to an hour. We invite all of our moms to come back and take a load off.
Let's get baby's heartbeat.
Dr. Anita Showalter schedules clinics at the center every Wednesday to see pre- and postnatal patients.
Every woman deserves to have her baby in a safe place.
A recent March of Dimes report found that over a third of U.S. counties are maternal care deserts. That's more than 2.2 million women of childbearing age and 146,000 babies born in areas without obstetric providers or hospitals or birth centers offering obstetric care.
Obstetrical units and hospitals have been closing across this country, and obstetricians, we're not increasing them.
Dr. Elizabeth Chereau says part of the reason is limited funding, and as a result, the maternal care deserts contribute to the high U.S. maternal death rate. A new CDC report shows that in 2021, there was a 40% increase in the death rate from maternal causes in the United States compared to 2020. After a spike during the pandemic, preliminary data suggests that the number of maternal deaths began dropping in 2022, but the numbers were still higher than experts would advise.
This is a crash course in obstetrics.
Rachel Morris, a maternal fetal medicine specialist at the University of Mississippi Medical Center, and her team have been trying to fill the gap, training well over 400 first responders in parts of the state that lack maternal care.
Push, 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 push. Almost 90% of the mortalities we had over a 2-year period were deemed preventable.
According to the CDC, Black women have a 3 times higher maternal mortality rate than non-Hispanic white women. Though all ethnicities did see an increase in 2021, women over the age of 40 have a 7 times higher mortality rate than women under the age of 25.
Feeling okay today?
Yes, ma'am. At 38 years old, Dominique Armour is considered to be in her advanced maternal age. She's pregnant with her 10th child, putting her in a high-risk category. The only hospital in the county hasn't had a delivering physician in more than 5 years, and access to prenatal care is also limited.
This is my last baby that I'm going to have, so I just wish they had a doctor here.
Do you have somebody to drive you?
Alice Rogers with the Arkansas Birthing Project is exploring options like this March of Dimes mobile clinic to get women in the area access to more care.
This unit is doing what it can to provide services to the women.
It's just not enough.
It's just not enough.
And our thanks to Faith Abubey for that report. It just seems mind-blowing that with all that we have in science and medicine, that women would still be dying giving birth to children. It's obviously a complicated and complex problem, but short of more doctors moving into these areas or women leaving these areas, what do you do?
Well, I think those are the two, obvious kind of responses to this, but that's far from ideal or logistically feasible. So the only thing that's left is for the woman to take charge as much as possible of her health and wellness before she gets pregnant. And we're seeing women having to do that now for other reasons, right? With the whole abortion situation in this country, women in every state, but pregnancy is no different. So that means really making it a priority to keep yourself in as healthy a condition as you can be, even if you have no immediate intention or plans to become pregnant, because 50% of pregnancies in this country are unplanned. So a woman being in the best shape she can be in, the best health, will absolutely have a positive impact during that pregnancy. But this is a disaster, and it's an embarrassment, and we need to fix it.
Yeah, just so many hurdles for women in this country.
Yeah.
All right, Dr. Jen, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.